Behind these face masks, doctors on a mission of mercy. They're in COVID-stricken South Florida, unloading vital test kits.
The moment that we arrived and we had lines of people that have been waiting since 4 o'clock in the morning to get a test, not knowing if they were going to get tested or not, it immediately brought me back.
For months, Dr. Jacqueline Delmont and her colleagues at Somos, a nonprofit network of immigrant doctors, were on the front lines, working to bring free testing to hard-hit poor and immigrant communities in New York City. Now they've gone from one battlefield in Latino neighborhoods in the Bronx to another here in Miami Lakes, Florida.
Just living through the process all over again. It was exactly the same situation we saw in March.
Medical experts say testing is a key tool in stopping the virus's rampant spread throughout the country, yet access to this vital service is unequal.
If we don't get a handle on coronavirus in those communities, we will continue to be at risk of getting coronavirus. All of us need to solve this problem of inequitable access to testing.
ABC News and 538 analyzed test sites in all 50 states and D.C. using census data and test site info from healthcare company Castlight, and found that in and around many cities, so-called urbanized areas, testing locations were more scarce in predominantly Black and Latino neighborhoods than in their white, wealthier counterparts.
What we've seen in coronavirus is actually an exacerbation of pre-existing inequalities. The companies that are offering testing, many of those are located in predominantly white neighborhoods because of inability to make enough profit in these lower income communities. And so as a result of that, communities of color have less access to testing.
The study revealed particularly large disparities in testing access in and around San Antonio, Baltimore, Los Angeles, and South Florida. To help address this inequality, Dr. Delmont has been volunteering here without pay for weeks.
It's devastating that the communities that need it the most, the communities that have been most affected, the communities that we could have made a greater impact in controlling the pandemic have not had access to testing.
Born in Venezuela, Dr. Delmont has been working here, away from her family, without pay for weeks. She's devoted her career to helping her fellow immigrants.
It's an unprecedented time. I feel that all the resources that I've achieved during my career, I've been able to use my administrative skills, but my clinical skills, the empathy, coming from a family with limited resources, understanding that there are definitely differences in the communities.
16-year-old Natalie Choi's family also has limited resources. Her whole family has been sick for almost 3 weeks.
My mom, my dad, my little brother, then my 2 little baby siblings, and my grandpa all live with me. And pretty much everyone experienced symptoms, including the babies.
You live in what's called a multi-generational family. How realistic is it for you guys to have tried to social distance within the house?
Since my dad was the first one to test positive, it was realistic for him with his bathroom and his bedroom, and my mom just slept with the babies in the living room. But I share a room with my brother, so it wasn't realistic at all. We really couldn't do anything at all except wear a mask pretty much all day long, and we still do.
Her father speaks mostly Spanish, and thankfully, so do these volunteer doctors.
It was easy for my parents to communicate. It was easy for them to know what was going on and not me translating everything.
Plus, with Natalie's large extended family, testing wasn't just tough to find, it's tough to afford.
People who can have the money and the things just to be able to pay for every single test, they have much easier access. Like paying for $100 or $150, that's fine, but when it's 5, 6, or 7 people, some people just simply can't afford it.
If you don't have insurance, the only other options are to rely on publicly funded means of testing, whether that's through public health sites in your city or town, or through philanthropic funds, which have helped the many individuals who have organized to create free testing in communities of color.
Somos is one of those organizations forced to fill the gaps. Dr. Ramon Talaj is the founder. He immigrated from the Dominican Republic and founded Somos, which boasts 2,500 doctors who speak 5 different languages.
Our patients are immigrants like us. We speak the same language. We know exactly what's their problem about housing, money, jobs. Then we have to work with them in any way possible. We believe in the American dream.
We were with Dr. Talaj in the spring, visiting him in the Bronx, home to the highest rates of COVID-19 deaths in all of New York City.
Put your mask on.
Somos was one of the few lifelines to predominantly Spanish-speaking patients. When the testing was slow to come, they took action, expanding to partner with New York State to add 28 additional testing sites.
From the beginning, we've been trying to get testing in our community, but we did it ourselves. We put on the line a lot of money, the doctors, to do ourselves, and we want to continue doing it for our own people.
Now, almost 3 months after we met Dr. Talaj, Somos is exporting their expertise to those most in need, like in South Texas. Sonia Gomez's husband had been reluctant to get tested, even though the entire family was showing symptoms.
He was very happy that they weren't asking any information about status or any papers, any information, because he didn't want to go at first. He was like, no, I don't want to go. And I was like, no, let's go get tested.
My colleague Marcus Moore was with Sonia and her daughter when they got tested at a new Somos testing site in Houston.
How far did you have to drive to get a test?
We drove about 30 minutes, but I was so glad that they were able to get us in quickly because I had tried other places and the wait was about 3 to 4 weeks. And
wait, hold on, 3 to 4 weeks to get a test?
Yes, because the free testing sites are very full right now.
As her family's only remaining breadwinner, she's hoping to test negative so she can go back to work.
How many testing centers did you check to try to get a test?
There was like around 3 or 4 around my area, including Walgreens and CVS. Some of them are doing it, but they don't have any testing available because it's full. They keep on saying to try back later, and I keep on trying later and later, every 2-3 hours, and it will give me the same message.
Just days after that Somos test, a result, positive.
It's very shocking and scary to know that all of us are tested positive, and it's so dangerous. People are dying. It's just crazy.
Sonia is just one of the tens of thousands of new people testing positive every day, a sign that the doctors of Somos and America have a long road ahead.
I know we struggle here, but we fight. And we find the way, whatever way it was.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel, and don't forget to download the ABC News app for breaking news alerts. Thanks for watching.